Welcome to the Total Joint Replacement Preoperative Education class by Mid-States Connecticut Orthopedic Institute. As an orthopedic navigator, I'll walk you through the steps to prepare for surgery, to know what to expect during your hospital stay, and to formulate a plan for returning home. I'll then work with your care team to set that plan in motion. At Mid-State Medical Center, our mission is to improve the health and healing of people and the communities we serve. Our vision is to be nationally respected for excellence in patient care and most trusted for personalized, coordinated care. Our goal for you is to be healthy, comfortable, and active. We want you to be able to move and enjoy life, but we do have expectations. We want you to participate in physical therapy and follow the treatment plan you and the doctor have agreed upon. It's important because that's how you're going to recover well. We want you to transition home and be safe. Your safety is the most important thing to us. Recovery from orthopedic surgery has changed. In the past, patients would stay in the hospital for several days and then go to rehab for 2 to 3 weeks. This is no longer the case. Joint replacement patients are expected to return home for recovery. Research proves that patients who go home recover more quickly. The first reason is that by being home, you're lowering the risk of infections. The longer you stay in any medical facility increases your risk of infection and other complications. We want to reduce that. The second reason we recommend home is mobility. Some people assume that because you receive therapy at rehab, that you will improve quickly, but that's not always the case. For safety, a medical facility will require that you only walk around and exercise with staff. That limits how much therapy you're receiving and how much you actually walk. At home, we encourage you to get up, do exercises, and to walk throughout the day, resting in between. Rehab stays are rarely needed for medical reasons after joint replacement. Because joint replacement is elective surgery, insurance companies expect you to plan ahead to return home. Your length of stay in the hospital has also evolved. Patients can expect to spend 1 night in the hospital. Some of our patients may be candidates to return home on the day of their surgery. If you are interested in going home the same day, please discuss this option with your surgeon or navigator. Before transitioning home, we must first evaluate how you are doing medically. A member of the medical team, with the direction of your surgeon, as well as the discharge planner, will speak with you if we felt you needed to stay longer in the hospital. If you're planning to return home on the day of surgery, you must have someone stay overnight with you for the first night. Our therapists strive to help you move independently. However, we do recommend that you have a coach. This can be a spouse, family member, or friend. A coach is someone who can stay with you the first few nights and later check in on you regularly. Your coach should be available to help with meal prep or household chores after surgery. We encourage your coach to be in the hospital for at least 1 physical therapy session. This way, they can see how best to help you and the safe way to exercise and move. Joint replacement patients who stay overnight should arrange to have their ride ready by 11 a.m. the next day. The following information about the Centers for Medicare and Medicaid Services bundled payment model is directed toward the patients with Medicare Part A or B as their primary insurance. Mid-State Medical Center does participate in the bundle payment model. The goal of the program is to improve the quality of care delivered to Medicare beneficiaries needing joint replacement surgery, to lower the costs for the care provided for joint replacement patients, and to help shift the U.S. healthcare system towards paying for quality rather than quantity.